In recent years, a profound and deeply concerning transformation has taken place within the health landscape of American children, marking a pivotal moment in public health discourse. This emerging crisis, characterized by an unprecedented surge in chronic diseases among the nation's youth, represents not merely a collection of individual health concerns but rather a fundamental shift in the well-being of an entire generation. Unlike the acute infectious diseases that once claimed young lives in previous centuries, this modern epidemic manifests through insidious, long-term conditions that are gradually becoming normalized in society's collective consciousness. The gravity of this situation cannot be overstated, as it touches every aspect of childhood development and future societal well-being. Chronic diseases, once considered rare or primarily adult-onset conditions, have now become alarmingly common among children and adolescents. These conditions span a spectrum of physical and mental health challenges, creating a complex web of interconnected health issues that threaten to redefine what it means to grow up in contemporary America. The normalization of these conditions, coupled with their gradual onset, has created a dangerous complacency that masks the true severity of the crisis unfolding before our eyes. This health emergency demands immediate attention not only because of its current impact but also due to its implications for the future. The children affected today will become tomorrow's adults, carrying forward these health burdens into adulthood and potentially passing them on to future generations. The cumulative effect threatens to create a cascade of health challenges that could overwhelm healthcare systems and fundamentally alter the nation's demographic and economic landscape. What makes this crisis particularly alarming is that many of these conditions are preventable, suggesting that the current trajectory is not inevitable but rather a consequence of systemic failures and societal choices. The scope of this health crisis extends beyond mere statistics or medical diagnoses. It represents a fundamental threat to the foundation of future society. The increasing prevalence of chronic conditions among children suggests a generation facing diminished quality of life, reduced educational and career opportunities, and compromised ability to contribute fully to society. This situation creates an urgent imperative to examine the root causes of these health challenges and implement comprehensive strategies to reverse this troubling trend. The chronic disease landscape among American children encompasses a diverse array of debilitating conditions that collectively paint a grim picture of pediatric health. Obesity stands as one of the most prominent and visible manifestations of this crisis, with its prevalence reaching unprecedented levels across all age groups. This condition serves as a gateway to numerous other serious health complications, including heart disease, diabetes, and various forms of cancer. The physiological burden of excess weight during crucial developmental years creates a cascade of negative health effects that often persist into adulthood, significantly reducing both life expectancy and quality of life. Diabetes, traditionally considered an adult-onset condition, has emerged as a major concern among children and adolescents. Both type 1 and type 2 variants are showing alarming increases, with the latter demonstrating particularly dramatic growth rates. This metabolic disorder, when developed during childhood, leads to lifelong management challenges and increases the risk of severe complications such as kidney failure, blindness, and cardiovascular disease. The psychological impact of living with diabetes from a young age adds another layer of complexity to this growing problem. Respiratory conditions, including asthma and allergies, represent another significant category of chronic diseases affecting children. These conditions not only compromise breathing and physical activity but also create persistent anxiety about potential life-threatening episodes. The rising prevalence of food allergies, some of which can trigger severe anaphylactic reactions, has transformed school environments and family lifestyles, requiring constant vigilance and emergency preparedness. Similarly, autoimmune diseases, where the body's immune system mistakenly attacks its own tissues, are increasingly diagnosed in children, leading to lifelong health management challenges. Perhaps most concerning is the surge in behavioral and neurodevelopmental disorders. Conditions such as autism spectrum disorder and attention deficit hyperactivity disorder are being diagnosed at rates that were unimaginable just decades ago. These conditions profoundly affect learning, social interaction, and emotional development, creating significant barriers to academic achievement and social integration. The impact extends beyond the individual child to affect families, educational systems, and ultimately, society as a whole. The combination of these various chronic conditions creates a complex web of health challenges that traditional medical approaches struggle to address effectively. The healthcare system's response to this pediatric health crisis has been largely inadequate, often exacerbating rather than alleviating the underlying problems. Medical institutions have frequently defaulted to managing symptoms rather than addressing fundamental causes, creating a cycle of dependency on medical interventions that fail to resolve core issues. This approach, while perhaps profitable for pharmaceutical companies and certain sectors of the healthcare industry, leaves children trapped in a perpetual state of managed illness rather than achieving genuine wellness. The focus on symptom suppression through medication has led to widespread over-medicalization of childhood, where normal developmental variations are increasingly pathologized and treated with prescription drugs. Corporate influence has played a significant role in shaping both healthcare policies and treatment protocols, often prioritizing profit margins over patient well-being. Pharmaceutical companies have successfully marketed their products as solutions to complex health problems, while downplaying lifestyle and environmental factors that contribute to these conditions. This commercialization of healthcare has resulted in treatment guidelines that emphasize medication management over preventive care and lifestyle modification. Insurance reimbursement structures further reinforce this approach by favoring quick-fix solutions and frequent medical interventions over time-intensive preventive measures and root cause analysis. The scientific community's response has been similarly constrained by existing paradigms and funding priorities. Research efforts have predominantly focused on developing new treatments rather than investigating and addressing the fundamental causes of these chronic conditions. This orientation has led to an accumulation of knowledge about disease management while leaving critical questions about prevention largely unanswered. The medical establishment's resistance to paradigm shifts, combined with the influence of vested interests, has created significant barriers to implementing more holistic and preventive approaches to children's health. This institutional inertia has effectively maintained a status quo that continues to produce generations of chronically ill children. The mental health landscape among American youth has deteriorated to alarming levels, creating a parallel crisis that mirrors and often compounds the physical health challenges faced by children. Depression has reached epidemic proportions, with nearly half of teenage girls experiencing major depressive episodes annually. This profound emotional distress manifests in various ways, from withdrawal and academic decline to self-harm and suicidal ideation. The psychological toll extends beyond clinical depression, encompassing a spectrum of anxiety disorders that severely impact daily functioning and quality of life. Social media platforms, while providing connectivity, have paradoxically contributed to increased feelings of isolation and inadequacy, creating a perfect storm of mental health challenges. The consequences of this mental health crisis extend far beyond individual suffering, affecting educational institutions and future workforce capabilities. Schools report unprecedented numbers of students requiring special accommodations due to mental health conditions, while dropout rates among those struggling with psychological disorders continue to climb. The cognitive and emotional impacts of chronic mental illness during formative years create lasting effects on intellectual development and social skills acquisition. This generation faces unique challenges in building resilience and developing healthy coping mechanisms, partly due to the pervasive nature of digital technology and social media in their lives. Suicide has emerged as a particularly devastating manifestation of this mental health crisis, becoming the second leading cause of death among teenagers. The increase in suicide rates among young people reflects not only individual struggles but also broader societal failures to provide adequate support systems and early intervention resources. Emergency rooms across the country report surging numbers of youth presenting with suicidal thoughts or following suicide attempts, overwhelming mental health services and highlighting the inadequacy of current support structures. The intersection of mental health challenges with other chronic conditions creates complex cases that strain both healthcare systems and educational institutions, demanding comprehensive approaches that address both physical and psychological aspects of children's well-being. The roots of this pediatric health crisis extend deep into the fabric of modern society, with several key environmental factors playing significant roles in the deterioration of children's health. Ultra-processed foods, now ubiquitous in American diets, deliver a potent combination of refined carbohydrates, artificial additives, and industrial seed oils that disrupt metabolic processes and promote inflammation throughout the body. These food products, engineered for maximum palatability and shelf stability, displace nutrient-dense whole foods from children's diets, contributing to both obesity and malnutrition simultaneously. The aggressive marketing of these products to children, combined with their widespread availability in schools and communities, creates an environment where making healthy food choices becomes increasingly difficult. Chemical exposure represents another significant environmental factor contributing to the health crisis. Thousands of synthetic chemicals, many untested for safety, permeate children's environments through various pathways. Pesticides used in agriculture, endocrine-disrupting compounds in plastics, and toxic substances in household products accumulate in developing bodies, interfering with hormonal systems and neurological development. Air and water pollution introduce additional contaminants that exacerbate respiratory conditions and may contribute to the rising rates of autoimmune diseases and cancer among children. The cumulative impact of these chemical exposures creates a toxic burden that young bodies struggle to process and eliminate. Technology use, particularly screen-based devices, has fundamentally altered children's daily lives and biological rhythms. Excessive screen time disrupts natural sleep patterns, reduces physical activity, and affects brain development during crucial growth periods. The blue light emitted by digital devices interferes with melatonin production, leading to sleep disturbances that compound existing health issues. Furthermore, the sedentary nature of technology consumption contributes to poor posture, musculoskeletal problems, and decreased cardiovascular fitness. The psychological impact of constant digital connectivity adds another layer of complexity, with evidence suggesting links between excessive technology use and increased anxiety, depression, and attention difficulties among children. Addressing this multifaceted health crisis requires a comprehensive, multi-pronged approach that transcends traditional healthcare boundaries and embraces radical transparency in policymaking and implementation. The proposed strategy must begin with a fundamental re-evaluation of food systems, prioritizing access to whole, minimally processed foods in schools and communities while implementing stricter regulations on the marketing and formulation of ultra-processed products targeted at children. Agricultural policies need reform to reduce chemical inputs and promote sustainable farming practices that protect both human health and environmental integrity. Simultaneously, comprehensive environmental protection measures must be enacted to limit children's exposure to harmful chemicals, including stricter regulations on industrial pollutants, improved water quality standards, and restrictions on endocrine-disrupting compounds in consumer products. Education systems require transformation to incorporate comprehensive health literacy programs that equip children and families with the knowledge and skills to make informed health choices. These programs should emphasize the importance of balanced nutrition, physical activity, and healthy technology use while fostering critical thinking about media messages and corporate influences. Healthcare delivery must shift from reactive symptom management to proactive prevention, with increased funding for research into root causes of chronic diseases and the development of effective prevention strategies. Mental health services need significant expansion and integration into primary care settings, with particular attention to early intervention and community-based support systems. Policy changes must prioritize children's health above corporate interests, implementing regulations that protect young people from exploitative marketing practices and ensure access to safe, healthy environments for growth and development. This includes restricting advertising of unhealthy products to children, mandating clear labeling of potential health risks in consumer products, and establishing robust monitoring systems for environmental toxins. The healthcare system itself requires restructuring to incentivize preventive care and long-term health outcomes rather than short-term interventions. Achieving these goals demands sustained commitment from government agencies, healthcare providers, educators, and community organizations working collaboratively to create environments that support children's health and well-being. As we've explored throughout this discussion, the health crisis facing American children today represents one of the most pressing challenges of our time. From the alarming rates of obesity, diabetes, and autism to the mental health epidemic gripping our youth, these aren't just statistics. Their real lives being profoundly affected every single day. The evidence is clear. Nearly half of our children are dealing with at least one chronic health condition, and over 3/4 of young people aren't even qualified for military service due to health issues. We're seeing unprecedented increases in food allergies, autoimmune disorders, and behavioral conditions that are reshaping the landscape of childhood in America. But here's where you come in. This conversation doesn't end here. In fact, what we've discussed today is just the beginning. The upcoming reports promise to deliver concrete strategies and action steps that could help turn this crisis around. But real change won't happen without awareness and action from all of us. If you found this information concerning, or even alarming, please share this video with your network. Engage in conversations with your friends, family, and community about these issues. And most importantly, subscribe to this channel and hit that notification bell, because we'll be diving deeper into potential solutions and prevention strategies in future videos. Remember, the health of our children affects us all. It impacts our education system, our healthcare infrastructure, and ultimately, our society's future. Let's work together to build a world where chronic disease isn't automatically associated with childhood. Thank you for watching.